Hey everyone, this is Steph at Hybrid Fitness. Today we're going to talk about, and I'm going to show you some exercises that you can do during your third trimester. So helping me out today is Laura. Laura, how many weeks along are you?
I'm 37 weeks today.
37 weeks, so she's getting closer to that date. Same thing applies in your third trimester as your second, so we're going to avoid any prone exercises, supine exercises, just because of the weight of the baby inside of her. But that doesn't mean that we still can't continue to strength train and do compound exercises. Now with Laura, because she's going to be spending the next few months primarily breastfeeding and sitting, I want to focus more on her posterior chain. So that would be her shoulders, her rhomboids, her lats, her glutes, and her hamstrings. So today we're going to be doing a hex bar, or it's also called a trap bar deadlift. Show you that. We're going to do some pull-aparts, and then we're going to do a pale-off press because she won't be able to do any more hanging exercises just because of the weight of the baby and the fluid inside of her belly. So first, Laura, I'm going to get you to set up inside the hex bar. So you're going to take a step in, and I want you to situate your feet about shoulder width distance apart, toes slightly outward, and we're going to get the weight in your heels now. From here, I'm going to get you to take a big breath in, lift your chest up, and I want you to squat down and grab the handles right in the middle. Perfect. From here, her eyes are forward, her chest is up, and I'm going to get you to drop your butt just a little bit to have that nice flat back with a slight natural lumbar curve. From here, she's going to take a big breath in, and as she exhales, she's going to push her hips through, squeezing her glutes to stand. She's going to inhale as she lowers down with control, and then exhale to stand. Give me 4 more here, Laura. So as she does this, again, I'm going to cue her to keep the weight in those heels, always thinking about squeezing and contracting the glutes, and also thinking about squeezing her upper back, her shoulder blades to engage her whole posterior chain. This is a great exercise for that. And again, it's a compound lift, so she's training her whole body with one exercise. All right, awesome. So take a step out, Laura. That was great. Next, we're gonna move into band pull-aparts. I'm just gonna pull the bar out of the way. For band pull-aparts, Laura's gonna get a band. This is a great tension band because it's not gonna be too restrictive, and it's also gonna be not easy as well. So I'm gonna get you to grab the band about a foot width distance apart. And from here, I'm going to get her to pull her shoulders down and back and retract her shoulder blades. So she's actually going to pull them back, and then she's going to open up. And again, thinking about that upper back activation, trying to squeeze my fingers or squeeze a pencil between her shoulder blades. This exercise is great for the rhomboids. It's also going to be great, again, for her core. Just because she's not doing ab exercises doesn't mean she's not working her torso, even just to stabilize in this position. So this is a great one for that. And again, thinking about all the breastfeeding she's going to be doing, she's probably going to be internally rotated for the next few months. So again, trying to open her up and stretch out her chest while also working and activating her upper back and her rhomboids. Great job. Okay, we'll set that off to the side. One of the final exercises we're going to do for Laura, again, just because the baby's going to be a little bit bigger now, she's not going to be able to do hanging exercises like pull-ups. We're going to do something called a pale-off press. Now, this is an anti-rotation exercise, we call it, because her body's going to want to twist and rotate, but she's going to stabilize using her abdominal muscles and her glutes to prevent that from happening. So, Laura, I'm going to get you to grab this band with your inside hand. I'm going to get you to step out and put some tension on that band. Now, starting with the band about just top of the belly, she's going to stabilize, ground through her legs, weights in the heels, knees are out slightly to engage the glutes, and she's going to gently and slowly reach out with those arms and then come back in. So as she does this, that band's going to create some tension, wanting to force her to turn. But that's the joy and the great thing about this exercise is she's going to stabilize, she's going to prevent that twist and rotation. In doing so, challenging her glutes, her balance, her abdominals, especially transverse abdominals, those deep muscles, and then also working chest and shoulders as well during this exercise. Give me 2 more. And last one. Great. Now, obviously, she would do this on the other side as well to balance out both sides, but these are just some of the exercises you can use in your third trimester and some of the ways you can modify current exercises so that they work. When you work out, it's stress on the body, right? It's a good stress, but it's still a stress. So we're training our bodies not only to be strong and to go through that stress, but also recover afterwards. So those little bouts of exercise and that little stress you put on the body, mentally it's gonna make the mom a lot stronger, and then physically a lot stronger as well. And there's so many benefits to exercise and the effects on baby as well. So generally speaking, the studies have shown that moms who exercise during pregnancy are gonna have healthier, happier babies. So it just works all around.
It felt really good. I'm 37 weeks today, so those exercises are great for me. I'm having a lot of pelvic girdle pain, so I can't do a lot of single leg stuff, but these exercises, I didn't feel any discomfort at all, so.
Yeah, well, I like to say that, giving birth is going to be one of the hardest exercises you're ever going to do, right? So how do we prepare for anything? Think of it like even training for a marathon. Pregnancy, that's your training, and then that birthday, that's going to be that race, that competition. So whatever you can do to prepare yourself leading up to that is going to be beneficial. I personally like to choose a lot of compound exercises to work multiple muscle groups at once. The trap bar deadlift works really great, and it also gets women to really think about keeping a strong and stable torso, and that translates into when they're pushing, getting those contractions, working on their breathing, things like that. With Laura, because she has a little bit of pelvic girdle pain. I've had moms in the past who have pubic symphysis dysfunction where their pubic bones actually rub against each other. So things like the deadlift actually work for them. Sometimes squats work well as well. Things you would want to avoid if you had that condition would be single leg exercises like Laura mentioned. So any single leg Romanian deadlifts or lunges, that can irritate it some more. So the deadlift's a great exercise because it complements both everything leading up to birth. You get that great exercise of the full body workout, and then it's not going to cause any complications with any predisposed conditions you already have. Please consult with your doctor before participating in any form of exercise or fitness programs during pregnancy or shortly thereafter.